Hello everyone, my name is Colette and I am doing my pediatric rotation and I will be presenting on pediatric cases. I didn't have many interesting pediatric cases in the clinic this week. However, I did have one particular case I will be presenting on. The identifying data of Gigi, an 8-year-old African American female who was brought in by her mother, who is a good historian. The chief complaint that was presented is bilateral redness and swelling to the eyelids. As far as the HPI, Gigi came in today with her mother with complaints. The child is having irritation to her bilateral eyelids. The mom reports that Gigi has been playing outside over the last few days and felt something in her eyes. After which she started complaining of itching and burning for the last 2 days. The mom reports associated redness, swelling, and crusty discharge continuously, especially worse in the morning. She had tried some over-the-counter eye drops that were recommended to her by a pharmacist, but the irritation and redness seems to be getting worse. She denies any associated fever, any associated eye pain, or any associated changes in visions. She brought her in today for an eye examination. Gigi doesn't have any past medical history, no past surgical history, no known allergies, and no food allergies or no seasonal allergies. As far as medication, she is taking over-the-counter refresh eye drops. She is up to date on all her immunizations, and the child lives with both her parents. Her father, who is 36, otherwise healthy, no health conditions, and the mother, who is 33, with no health conditions. She has not been around any other sick contacts. Her review of symptoms, the mother denies any fever, denies any chills, denies any weight loss or weight gain. Her skin, mother denies any rashes, lesions, moles, or skin discoloration. Her eyes, however, the mom reports redness and swelling, and reports burning feeling from the child in the eyes. However, they denies any loss of vision or any photophobias. Cardiovascular-wise, she denies any chest pain, denies any palpitations. Respiratory-wise, she denies any cough, denies any shortness of breath, or denies any congestion. GU, no problems with, she denies any frequency, urgencies, or any burning upon urination. Neuro, she denies any weakness, any tingling, any seizure activities, denies any numbness. Musculoskeletal, she denies any joint pain, denies any joint tenderness, and denies any joint stiffness. So, upon physical examination, the child weighs 60 pounds. She is approximately 4 feet 2 inches tall. Her blood pressure was 108/71. The pulse was 81. Respirations were 22, and her temp was 98.7. Generally, she was a healthy, well-developed appearing little girl sitting up in a chair. She was well-groomed, well-dressed, answering appropriately. However, she was rubbing her eyes. Her skin was warm, dry, good turgor. I didn't see any lesions, no rashes, no moles, and cyanosis of her lips and nails on inspection. Her head was normal. on inspection, atraumatic with good distribution of hair. Her eyes were, of course, with a thumoscope, she had redness and swelling of the eyelids, along the margins of the eyes. The conjunctiva had a long red streak bilaterally, and she did have some flaky and crushiness eye debris along the eyelashes. Red reflex was present. The ears, there was no redness, no tenderness, no discharge on otoscope. The bannock membranes were clear, pearly gray, bilaterally, cone of light of 7 on the right and 5 on the left. Her nose was clear. There was no nasal discharge, no nosebleed, no septum deviation, and the mucous membranes were pink and moist. Her cardiovascular regular rate and rhythm, S1, S2 heart sound, no lifts or heaves palpated, and no murmurs or gallops auscultated. Respiratory rate was even and unlabored. There was no wheezes, no use of her accessory muscles to breathe, and clear on auscultation. Musculoskeletal, she was full of range of motion in all 4 extremities and normal balancing gait. Psychiatric, her behavior was good, but of course she had the childhood imagination that she had a bug or something in her eyes. So, the differential diagnosis that I came up for her, first one was bilateral bacterial conjunctivitis. The second one was allergic contact dermatitis, and the third was periorbital cellulitis. But the leading diagnosis was blepharitis, ICD-10 of H01 0.009. Okay, the treatment plan that I came up will be erythromycin 0.5% ointment, and she would apply that 4 times a day, a half a ribbon. Of course, some warm compresses to the eyes for about 10 to 15 minutes, up to 6 times a day. Education-wise, I would educate the mom on hand hygiene and the child on keeping her hands clean and dry, using a warm washcloth, of course, massaging the eyelids, and the use of artificial tears. If she does not feel well, if her condition is getting worse, I would advise her to go to the emergency department if she has any changes of vision or anything like that. And of course, this was all diagnosed on examination with the eye exam. And we did take a culture of the eye discharge so that we can check what type of bacteria is possibly growing. Thank you for my presentation.